And how are we doing?
In the weeks surrounding the November 3rd election, Florida's Department of Health all but stopped reporting deaths that had taken place more than a month earlier, making overall death numbers appear much lower. Days after the election, the department went back to reporting those backlogged deaths as first reported by the Sun-Sentinel newspaper. Why? The state isn't saying. But CNN has interviewed more than a dozen state officials and experts and finds Governor Ron DeSantis' administration has sidelined health experts, promoted questionable science, and left some county officials feeling muzzled from raising the alarm about rising cases.
They're not necessarily at liberty to release all the information that they might want to release.
Dr. Eileen Marty, an infectious disease expert at Florida International University, says the governor's approach to the virus has made it worse.
It's counterproductive.
Is it also deadly?
It leads people towards behavior that increases transmission. Bottom line, it leads to more deaths.
In recent weeks, Governor Ron DeSantis has defiantly kept restaurants and bars open, joined the maskless crowd tweeting this picture from a high school football game, and scoffed at the notion of more government-mandated shutdowns, no matter how bad the virus.
If they want to shut down businesses, I'm going to stand in the way.
What he has rarely done is mention the 20,000 Floridians who have died or the more than 1 million who've been infected, seemingly, say critics, to downplay the virus, keep Florida's economy open in an effort to win an election for one person.
We're with the governor of Florida, Ron DeSantis, who's done a spectacular job in Florida.
He's doing a very miserable job when it comes to this issue here with coronavirus in the state of Florida, and I'll tell him to his face.
The governor's executive order has prevented county officials and mayors, like Carlos Hernandez, the Republican mayor of Hialeah, from enforcing local mask regulations or other restrictions that could have slowed the virus's spread.
Maybe he has a number in mind that it's okay for that amount of people to die or not. I don't know. But I think there's a lot more that we could be doing as a state.
Instead, health experts like USF's Dr. Marissa Levine say DeSantis' administration controls the messaging about the response.
All of those decisions are made in Tallahassee, and I suspect that the governor's office.
Two Department of Health employees tell CNN in late September they were told to not focus on COVID-19 in their public messaging. Both workers who asked not to be named said they were afraid of being fired. We're putting politics in front of lives, one said. And sure enough, the state's public messages about coronavirus almost entirely vanished. The Florida Department of Health's website and social media accounts used to be filled with COVID information and advice. But on September 25th, the day the governor signed his order that fully reopened Florida, all of that changed overnight. The tweets and Facebook posts suddenly were about infant hearing loss, carbon monoxide poisoning, and the flu shot. Up until Thursday, the Department of Health's website was filled with a weeks-old image promoting National Diabetes Awareness Month, which was November. To find the latest news on COVID-19, you need to click on a link.
The governor made up his mind about what the right thing to do was, found people who supported that, and then went ahead. The problem is it was kind of an all or nothing, and it undermined a lot of the local efforts.
Florida's governor's office and state health department refused to answer any questions.